Well, the demand for the new COVID vaccine in some areas is superseding the supply. Some people are having a hard time finding an appointment to get one.
Today is also World Mental Health Day. It's a day to create awareness and reduce the stigma of mental health.
Here with the latest medical news, UW Health's Dr. Jeff Pothof. Good to see you.
Hi, Dr. Pothof.
Hey, let's start with COVID.
Yeah.
It's hard to get an appointment, and when is too late going to be?
Yeah, I don't know that there's ever like a too late, but I would say, unlike before where you could go online and book an appointment for the same day, it takes a little bit of pre-planning. So you have to go and look at, either CVS, Walgreens, or one of the other kind of national pharmacy chains. Starting to see some supply in local health systems, including UW Health. You almost have to plan ahead to be like, okay, like next week, Thursday, I can probably go during this time, and then you can get it scheduled. But the supply is not yet caught up, but I think we're getting close. We're starting to see more health systems get this, so we're seeing a little bit less delay. So hopefully in the next week or two, we won't be talking about this as much, but it is tricky right now.
That's encouraging that the supply is easing up a little bit. The supply of flu shots seems to be okay. So should you get your flu shot now while it's available, or should you wait until so you can do both in one appointment?
There's certainly that convenience factor of getting them together, and I think let's say you live somewhere where you have to travel an hour to get your shots and stuff. I don't know that I would have a lot of reservations about just trying to group those together, but let's say you're in Madison where it's really pretty easy to get that. There is no harm in saying, all right, I'm gonna get my flu shot because I've got nothing going on tonight, and then I'll schedule this COVID vaccine for next week when I can get in, when they have an appointment for me. So best case scenario is be vaccinated as soon as you can. You never know when you're gonna run into either flu or COVID, but if it's inconvenient, no problem in getting those together.
Just go online every morning and check, and eventually you'll find one.
Exactly.
I got mine out over the weekend, so
there you go.
Good to go. Let's talk about the World Mental Health Day. 150 countries have this day.
Observe
it. Thank you. So how big of a problem? This is a growing problem in the world.
Yeah, I mean, mental health is this huge problem, and I think one of the reasons it's such a huge problem is, unlike other diseases like diabetes or cancer or heart disease, we often think that there's something intrinsically wrong with the person who has a mental health problem versus treating it like a medical condition. So then I feel like people are sometimes ostracized, or they should be doing something, trying harder. We're not as quick to devote resources to it because we feel like maybe if they would have made different choices, this wouldn't have happened. We got to get away from that. Mental health is a neurochemical problem that folks have, and we should be supporting these folks. I think the thing that makes mental health so difficult is if I've got diabetes or high blood pressure, I can successfully go to work, I can interact with society, I can kind of do these things and support myself. With mental health, oftentimes I may want to be at work and do these things, but I can't. So now I don't have a job, and now I can't pay for things, and I kind of get left behind. So we need to really invest in mental health care. This country, other countries, understand where these people are coming from, because at the end, I think it makes society all better, not just the people suffering from the disease.
Is it part of a routine physical yet?
I think for a lot of routine physicals, your primary care doctors are going to ask you questions that kind of get at least into the depression side of things. Depression is very widespread, oftentimes fairly easily treated. I think whether you realize it or not, your primary care doctors are asking you questions to try to gauge, are you someone who's depressed or not?
And there's still a stigma for some people that the mental health is a stigma.
I think so, and to the point where folks are hesitant to ask for help because they're worried about what other people are going to think about them. I think we gotta get rid of that, but certainly for your primary care provider or your doctor, we get this. This is a medical condition. If you're having trouble with depression and things like that, bring that to us. We want to help you with that.
And there are a lot of resources now, the 988 Lifeline.
Absolutely.
And all kinds of things that people need to take advantage of. Can I go back to COVID for just a second? Does it matter if you get Moderna or Pfizer anymore?
I'd say no. So earlier on in the pandemic, there was a little bit of a different in, like, let's just say the recipe that they use, and they were targeting similar things, but they're a little bit different. So we talked about, like, should you mix and match and things like that. Now, what they're targeting is exactly the same. So I'd say it matters really not at all whether you get Moderna or Pfizer. Doesn't matter what you've had in the past. Really, whichever one you get an appointment for first is probably the one to get.
You don't even really get a choice now, do you? It's whatever they have?
It depends.
Okay.
And if insurance covers this, but if you don't have insurance, go to public health.
Exactly. So you should still be able to get your vaccine for free. Just takes more work. If you have insurance, make sure it's a network. If you don't, talk to public health. There's ways to get it.
Right. It didn't hurt at all.
But why does his arm got very warm?
Yeah.
Why did that
It's
happen?
still warm.
Well,
It is still warm, actually. I can still feel it.
Doctor's explanation is basically your immune system needs to get to that vaccine so it can make an immune response. And to do that, you have to increase blood flow to that area. Blood is coming from your core. It's much warmer. When that gets out in the shoulder, you can feel it. It feels like a hot spot.
Both in one arm. That was.
So it's working.
It's working.
It's working.
All right. Doctor,
Thank you, Dr. Pothof.
You bet. Anytime.